Hello, and welcome to Simply L.H.A.B. Lifestyle, Health, Arts and Beauty. In today's episode, I will discuss the struggles and mistakes we are facing while wearing the mask. Why is my face mask giving me acne? Plus, how to deal with fogging of glasses and what to do if you've got breakouts. As the concerns of the COVID-19 pandemic advances, we covering ourselves before leaving our home. Mask, gloves and consistently, sanitizer. However, the cost of the hindrance between the infection and ourselves is a progression of regularly disregarded yet constant issues, for example, foggy glasses, ear hurts and sometimes skin breakouts. Wearing a face mask is a significant technique to diminish the spread of the coronavirus that causes COVID-19. As the pandemic proceeds, more proof shows the efficiency of masks, and more places necessitate individuals to wear them. Since masks are necessary, it's significant to do whatever we can to conquer worries about wearing them. Now and then, for certain individuals, wearing a mask can cause, or exacerbate, rashes, breakouts and other skin problems on the face. However, so-called Maskne, mask plus acne, isn't constantly associated to acne. You may see some facial breakouts as a potential side effect of mask use. Who is bound to get skin issues from wearing a face mask? Individual might be more likely to encounter face mask-related bumps and rashes in the event that there is of now living with skin issues, such as rosacea is a typical skin condition that causes redness and noticeable blood vessels in your face. It might likewise create small, red, pus-filled bumps. These signs and symptoms may erupt for a considerable length of time to months and afterward disappear for some time. Acne for the most part creates when pores get clogged by oil, dead skin cells, cosmetics, dirt, or bacteria. Masks likewise give the ideal moist condition for bacteria to grow in our skin, which can prompt to a breakout, whiteheads, or pimples that can vary in size and type, depending on how infected they get. Atopic dermatitis, otherwise known as eczema, sensitivity to humid or dry air, allergies, the skin around the nose, mouth and chin, the places covered by a face mask, is fragile, and one thing we're seeing all frequently these days is perioral dermatitis, a condition like rosacea. Individuals with perioral dermatitis have recurrent episodes of a red, bumpy rash around their mouth and chin. The part around the eyes can be affected, as well. Women between ages 20 and 60 are most likely to have the condition, and the reason is still unknown. Steroid medicine might be the cause in some cases. Are you allergic to your face mask? Certain commercial face masks are pre-treated with formaldehyde to disinfect them. In case you're sensitive to that chemical, those masks could start a breakout. Furthermore, synthetic fabrics are an issue for certain individuals. Similarly, laundering washable masks with severely scented detergents or softeners can cause itching, redness or rashes. Selecting a natural fiber cloth mask and unscented laundry products can help avoid skin irritation or sensitivity. There are three principal ways masks cause breakouts. Rubbing. Masks can cause irritation through friction and chafing, nearly like rug burn. The areas most at risk are the bridge of the nose and where elastic bands hit behind the ears. After some time, firmly fitting masks can put enough pressure on the skin to cause it to break down. Irritation. The material of a mask absorbs the skin natural oils. For certain individuals, this prompts to dryness and sensitivity. Residue from detergents and fabric softeners also gets stuck underneath the mask and can cause irritation. At the point when irritation becomes inflammation, you see redness, dry patches, peeling, or dark marks. In the event that you have skin conditions like rosacea or psoriasis, the inflammation aggravation can make it flare. Occlusion from a mask similarly causes issues. Pores get clogged and can become pimples or acne cysts. Your breath caught beneath the masks makes the skin surface warm and damp. Besides regular acne, this condition can lead to a breakout called folliculitis, which is when yeast or bacteria contaminate hair follicles. Ensure your mask fits correctly. A significant part of wearing your mask appropriately is confirming that it fits your face and covers both your nose and your mouth. To help prevent from irritating, your face mask shouldn't gap excessively. Yet, it shouldn't be too tight either. Masks with ties can be simpler to correct the size and shape of your face. A bendable piece over the bridge of the nose can help guarantee a good fit and keep the mask from fogging up your glasses, yet it can also irritate the nose if it is not cushioned by fabric. 8 key healthy skin tips to keep your face from any irritation. Wash your face first. Dirt and oil on your skin will get trapped under the mask and can cause breakouts. Always put your mask on over a clean face. Select a mild cleanser that is fragrance and oil-free. Rinse with lukewarm water, not hot. Avoid scrubbing or rubbing the skin. Apply a good moisturizer. Moisturizer keeps your skin hydrated and acts like a barrier to friction from your mask. Pick one that is fragrance and oil-free. Search for protective ingredients like ceramide and hyaluronic acid. Stay away from heavy products that can clog your skin and make you break out. Wear only clean masks. Dirt and oil from your skin, in addition to bacteria from your mouth and nose, will end up on your cloth mask. Have a rotation of masks on hand and wash them after each use. Stick to fragrance-free laundry detergent and lay flat to dry. Scent within fabric can be an irritant. So you certainly don't want it on your face. Don't reuse surgical masks. Surgical masks are not intended to be reused. The fact that there is no good way to clean them. Protect your ears. Elastic tie loops can cause friction burns on the back of your ears. In the event that your skin is sensitive or if you'll be wearing a mask for a significant length of time, there are choices. You can attach the straps to buttons on a headband or to a clip behind your head. Avoid harsh products. Medicated items like retinol or benzoyl peroxide are additionally disturbing under a mask. In case you're wearing a mask a lot, either use less of them or stop using them altogether. What about guys with facial hair? Specialist says facial hair has the similar microbial environment as the rest of the face. We realize this cycle can be really hard on those beards and mustaches. Facial hair can present a problem given the fit of the mask, the warm air that gets trapped under it and moisture from sweat. But there's hope and help for you too. If you need to wear your mask for a long period of time and aren't in a position where you can wash your face, specialists recommends using a simple toner with alpha hydroxy acid or even witch hazel to freshen your skin and avoid unnecessary problems. Just make sure you permit your skin and beard to completely dry before putting your mask on. For healthcare professionals, surgical masks fit over facial hair. For those who might need to wear N95 respirators, guidelines state you can't have facial hair contacting the mask, so a few men are shaving. They includes that regular shaving can cause irritation around follicles and ingrown hairs. How to treat different kinds of skin issues from face masks. If your skin is already feeling the effects of mask wearing, here's what you can do for some of the most common problems. Dryness, skin peeling. Dryness and peeling can be the first indication of mask irritation. After some time, your skin can become prone to sensitivity, redness, dark marks and breakdown. To fight this, consistently apply moisturizer before wearing your mask. After taking it off, apply pure petrolatum ointment. Redness, swelling. If you have redness and swelling after taking off your mask, icing the skin can help. You can use ice cubes in a bag or frozen peas. Cover with a paper towel and apply to the skin for a few minutes at a time. Follow with a small amount of over-the-counter hydrocortisone 1% cream. Note: use the hydrocortisone only as needed. Be careful not use it too much or too often. Overuse can thin the skin and make you break out. Don't apply your mask right on top of the hydrocortisone. That traps it in and makes it stronger. Skin breakdown. If you have fissures or breaks in the skin, cover them with a hydrocolloid dressing before putting your mask on. After removing the mask and washing your face, apply pure petrolatum wherever you need it. Acne, breakouts. If you're getting pimples under your mask, change your moisturizer. Look for something light that is non-comedogenic. This means it won't clog your pores. You can add a glycolic acid wash or a sulfur soap to your regimen. Avoid leave-on products that will end up trapped under the mask. If your breakouts are severe or don't get better, you might need prescription medications. Skin problems. When to call the doctor. Any skin breakdown that doesn't heal, in spite of home treatment, warrants a call to the specialist, and the same goes for rashes that are spreading or worsening, or any indication of infection. Getting a professional opinion is particularly significant for people whose jobs or routines require a mask to be worn for extended periods. You may have the option to look for help without an in-person trip to the doctor's office. Some skin conditions can be diagnosed and managed using telemedicine, and clinician suggests contacting your primary care doctor or a dermatologist, as they might be able to work with you using pictures of your skin lesions sent by phone. How to prevent glasses from fogging over. Ever has that burning, itching feeling that comes from an exhaled breath blown directly into your eye? Indeed, well, it's regular enough with masks that may not be shaped appropriately to your face. So how do you know a mask fits well? A seal check is a quick check performed by the wearer each time the mask is put on. It determines whether the mask is properly seated to the face or if it needs to be readjusted. There are two types of seal checks: the positive pressure check and the negative pressure check. Positive pressure check. Don and adjust the mask for correct fit. Then, exhale gently into the facepiece. The fit is considered satisfactory if a slight positive pressure can be built up inside the facepiece without any evidence of outward leakage of air at the seal. Negative pressure check. Don and adjust the mask for a proper fit, then inhale gently so that the facepiece collapses slightly, and hold the breath for 10 seconds. If the facepiece remains slightly collapsed and no inward leakage of air is detected, the tightness of the mask is considered satisfactory. Other tips to keep the fogging under control: 1. Mold the nose bridge at the top of your surgical mask to your face to reduce the gap that permits warm moist air up to the glasses. You can apply a strip of tape that's specially intended for use on skin to the top edge of the mask to close the gap. 3. Wash your glasses with soap and water, then dry them with a microfiber cloth. 4. Slightly moistening a tissue, folding it and placing it under the top edge of the mask also does the trick. 8. Face mask wearing mistakes people are making. Wearing a mask or other face covering during this pandemic may not be most easy thing to do. It might restrict with your breathing, talking, and individuals appreciating your lovely face. Here's the problem though, wearing a mask or the same can guard others from you, particularly when they approach you. All things considered, you might be breathing out the virus without having any symptoms, even without knowing it. Wouldn't it be incredible at the point you could make mask wearing a bit simpler? What about leaving your nose out of the mask or perhaps simply cutting a hole in your mask? Well, that's a hack. But the issue with these hacks is that they, despite everything, leave your mouth secured, which is somewhat irritating. Who wants to speak into a mask, and how can individuals will notice in the event that you are sticking your tongue out at them? Well, there's continually wearing your mask on or below your chin. All things considered, you are still wearing a mask then, correct? It appears as though numerous individuals have adopted this strategy. These options may sound great. Yet, there's one problem with all of these arrangements. Your mask is not a scarf, a chin strap that keeps your hairpiece on your head, or a turtleneck sweater without the sweater part. It doesn't have a place below your nose and mouth. It's not a blindfold, eye cover, headband, or oversized earring either. It doesn't belong above your nose and mouth or hanging on your ear. Once more, when the mask is not covering your nose and mouth, you are rendering the mask not very useful or potentially even useless. This is the first of the following 8 common errors that individuals are doing when wearing masks or other face covers. Mistake 1. Touching or adjusting your mask repeatedly. There are portions of you that you shouldn't contact while in public, and your mask is one of them. Resist the temptation to use your hands to change your mask. Touching your mask can end up contaminating your mask with your hands or your hands with your mask. This can then result in rubbing viruses right into your face. As long as your face covering is fitting on your face and covering your mouth and nose, while extending below your chin, it is fine where it is. If you have an itch, think of something else to divert you. If you must adjust your mask, wash your hands carefully before and after you touch your mask. Mistake 2. Exposing your nose or mouth. As you can see, your mask or face covering shouldn't simply cover your nostrils, however rather ought to go up to the bridge of your nose. This will make more uncertain for some nostril slippage to happen. Mistake 3. Wearing a mask excessively free. This would resemble wearing a super, giant-sized protection when that just ain't your thing. In either case, you don't need things spilling out of the edges, as it were. Your face covering needs to fit snugly on your face. The more that your breath and other stuff from your nose and mouth can spill out into the air, the more pointless your mask becomes. Mistake 4. Wearing a wet or dirty mask. Deal your mask like you would underwear. Keep it clean and dry. Either substitute it with a new mask or wash it regularly, depending on the covering that you are using. In the event that your mask smells unpleasant or looks unclean, that is a bad sign. Mistake 5. Wearing a mask above your chin. Except you are wearing a plunger on your face, your mask won't generally fit snugly on your face when your mask is over your chin. It can easily ride up higher when you are talking, breathing, or in any event, humming a song, even above your mouth, which ain't great. Mistake 6. Using a mask with large number of or too large holes. Try not to be a mask hole. Or on the other hand, rather don't have a mask hole. Indeed, it might be more to wear a mask made out of something like a volleyball net. However, there's that pointless issue once more. It wouldn't serve its main purpose, blocking viruses from getting out into the air. A SARS-CoV-2 is not the size of a volleyball. Have you at any point ever seen a virus? That's the issue. It's very small. A mask that is too holey would be irrelevant. Mistake 7. Wearing your mask upside down. This relies upon the kind of face covering that you are utilizing. A bandana does not have a top or a bottom. However, medical masks do. They have a top that contains flexible metal that can twist around the bridge of your nose to make a tighter fit. This can help keep you from fogging up your glasses when you. In the event that your mask is upside down, this nose bridge wire or strip will be rather on your neck, which will make it more pointless. Mistake 8. Wearing your mask inside out. Wear your mask like you would join in an ethical discussion. Pick a freaking side. Furthermore, stay with it. Most medical masks have a reasonable inside and an unmistakable outside that are made out of various materials or developed in various ways. In this manner, such masks won't work correctly if they are inside out. Indeed, even with a face covering that's the equivalent on two sides like a bandana, you would prefer not to flip it around each time you wear it. That's because one side is going to be exposed to whatever comes out of your nose and mouth. The other side will be whatever happens to be in the air. They should never meet, except they are carefully washed before such an encounter. Whatever mask you are wearing, it is important that you wear it as effectively as possible. Have we missed anything? Let us know in the comment section.